we are excited to present Dr. Latif Murji. Dr. Latif Murji is a family and ER physician based at SCHC. Dr. Murji is the founder of the widely acclaimed HealthFacts Plus Clinic, a groundbreaking initiative that addresses vaccine hesitancy through physician-led phone conversations and has now broadened its scope to include cancer screening. His work with HealthFacts Plus has garnered national media attention and serves as a blueprint for engaging in communities in health literacy. Dr. Murji is a lecturer at the University of Toronto, where he has created a novel health equity curriculum for resident physicians based on the tenets of experiential and transformative pedagogy. He is the founder of non-for-profit organization Stand Up for Health, which delivers immersive learning experiences to train healthcare workers in health equity and advocacy. By night, Dr. Murji showcases his artistic flair as the lead vocalist of the indie alt rock band Parachute Thieves. Without further ado, please help me welcome Dr. Murji. Dr. Murji, whenever you are ready, please take the floor.
Okay. Thank you, Hannah and Amy. So let me share my screen and we will begin. Okay. So does this look good? Thanks, Amy. Okay. All right. So HPV is a virus that can be stopped. So I chose this title because we're going to be talking about prevention of the virus itself, which is through vaccination, but also prevention of cancer, which is through cancer screening. And there's been changes in this topic lately, so there's a lot of exciting updates for you. And also, I want to drill home a point that will save you even if you get nothing else from tonight. And that is that you can literally talk to me, a physician, one-on-one, and ask me all these questions at any time because we have the VaxFacts Plus Clinic, also known as HealthFacts, through SCHC. And this is a service that's available for you, all of you, and any patients, anyone in the community, and you can book online, and then I will call you and we can speak one-on-one. So hopefully I answer your questions tonight, but of course, if not, we can talk about this later as well. And we'll also have a Q&A in this presentation as well. So without further ado, let's begin. So what is HPV? So it stands for human papillomavirus. And let me just get everyone's face out of my screen. So there's over 200 types of this virus, okay? So we're not going to like eliminate this virus. We're not going to eradicate it. It's going to be around, and we want to prevent it from causing harm. More than 40 of the types of HPV affect the genital areas, and they can cause genital warts, they can cause cancer, or they can just cause benign warts that you might get on your hands and feet. And actually, on this call, most of us have HPV, okay? That's just a fact. 75% of sexually active Canadians will be infected with HPV at some point. And often, most HPV infections actually resolve on their own without symptoms. But there are certain types that can lead to cancers. So we number all of these subtypes. So if you're interested, the ones to know are 16 and 18. Those are the ones that are cancer causing. And type 6 and 11 are the wart causing. Those are the most common types of HPV. And some people think that this is something that is for women only, but no, actually, this is men and women. Everyone is affected by HPV, so this affects everyone. So how is HPV transmitted? So basically, anytime you have skin-to-skin contact, you can transmit HPV. So if there's HPV on a certain part of your skin, for example, a wart, it can transmit it to someone else, or even self-inoculation can happen. So it's not just intercourse, but intercourse is one of the most common ways that it's transmitted. You do not need symptoms. And when we're talking about intercourse, we're talking about oral, anal, genital routes, even non-intercourse methods, as I mentioned. And condoms reduce the transmission of HPV, but they do not make it zero. And we are seeing in men oral HPV infections increasing. And so that's leading to oropharyngeal cancer rates increasing, which further necessitates the importance of vaccination. So, as I mentioned, type 16 and 18 cause most of cervical cancers. That's 70% of cervical cancer. But I also mentioned there's all kinds of other cancers that are caused by HPV. So anal, oropharyngeal, penile, vulvar, and vaginal cancers as well. But the bulk of HPV, uh, or the bulk of cancers that are caused by HPV are cervical cancers. Okay, so that's like should be your automatic mental connection. But remember, there's all kinds of other cancers. That's why it matters just as much for men. And in terms of some prevalence, cervical cancer is the 14th most common cancer in Canadian women and fourth most common in women aged 15 to 44. And you might remember the PAP test, right? This is a way that we screen for cervical cancer. So we're going to get back to that in a bit. But what we want to talk about first is vaccination and how we can prevent these from even happening in the first place, because that's the most effective method, right? Let's just, an ounce of prevention is worth a pound in cure. Okay, so how do we prevent it? The vaccine. So the vaccine is called Gardasil 9, right? So I put this in bold and put stars beside it because I want you to just love this vaccine. It's great. Why 9? It's because there's 9 HPV subtypes that it specifically protects against. And within those 9 are actually the 4 that I've mentioned to you. So 6 and 11, those are the wart-causing subtypes. And then 16 and 18, which, as I mentioned, 70% of cervical cancers are those subtypes. So it actually protects against that as well. So this is a really good vaccine. They picked the subtypes that are the most um, the most common and the most distressing and the most cancer causing to protect against. So that's what we want, right? Um, Obviously, this is best given before you are exposed to HPV, which is why we give this to kids in grade 7 before they're sexually active. And we've shown through studies that in places where we've given this vaccine, there's been dramatic decreases in the rates of HPV-related diseases and cancers. So we know that this vaccine is very effective, and we know that it is totally safe, and it's recommended for both men and women, boys and girls. So let's talk about the situation in Ontario. So grade 7 students are basically, we have public health coming into our schools and giving the vaccine to kids in grade 7, boys and girls. And so this is the simplest way. It's free in school. That way it reaches all of our kids in Ontario. However, some people might miss it for whatever reason. And if so, there's catch-up programs. So you can still get it for free up to grade 12. This uh, is a two-dose vaccine. Okay, so usually it's, you get it on day 0, and then the next one is at 6 months after that. If you get it after age 15, so that's like after grade 10 usually, then you have to do 3 doses. Okay, so if you're older, you have to get a third dose just so that your immune system can have the same robust response. That's just because younger people are their immune system's very active, so they can produce the antibodies needed with just 2 doses. I know people are going to ask, what if you're over grade 12? What if you're, like a young adult or an older adult? Well, you can still get the vaccine. It's just that you might have to pay for it. This is related to the Ontario guidelines and what the Ontario Ministry of Health has decided that they will cover. And this is different than what Health Canada might be recommending. And those are policy related decisions. And I can show you a little bit more about that in a second. But if you are MSM, so that's a man who has sex with men, then you are covered for this vaccine up to age 26. And this is because we've identified that this is a higher risk group for HPV as well. So, from my understanding, we have, as we all know, grade 7, everyone can get it. If you miss it, there's catch-up programs up to grade 12, and then up to 26 years old if you're MSM. Otherwise, you can still get this vaccine, but you will have to cover it with insurance or pay out of pocket, and it's about $200 per dose. Okay, and then I dove into this a little bit just because I know people are gonna wonder, and it's gonna come up. So Health Canada has a whole website about this, or a web page where they talk about this in detail and what their recommendations are. And I noticed that this differs from the Ontario guidelines because Health Canada is not saying what they will pay for, right? Because health care is administered provincially. So Health Canada is just making guidelines. So they are saying that they recommend HPV vaccination for all individuals aged 9 to 26. But is that what it's funded for in Ontario? No. As I just mentioned, it's for grade 7 students, catch up till grade 12. And you can actually, like, according to Health Canada, they say up to age 45, you can get this vaccine, depending on your risk status. So this is a conversation that you would have with your physician, your primary care provider. And especially for immunocompromised individuals, this is definitely something that would be encouraged. And for them, it's 3 dose. Okay. And as I mentioned, anyone over 15 years old, also 3 doses. So I just wanted to clarify this for people because I know that people might be wondering. Okay. So now let's talk about screening. Okay. So we talked about vaccine. That's prevention. That's prevention of getting the virus in the first place or getting the infection, getting any symptoms getting warts, for example. Now we're talking about screening, and screening is a way of testing population in order to catch a disease such as cancer. So HPV screening traditionally has been done through a pap test, and that is in order to catch a cervical cancer in a very, very early stage so that we can treat it and prevent it from causing any problems at all. So the pap test was something that we used to do every 3 years. As of March 2025 in Ontario, we have changed how we do cervical cancer screening. Now it is an HPV DNA test, and it starts at age 25. And because it's such a sensitive test, so it's like a better test, we don't need to do it every 3 years if it's negative. We can wait till 5 years. So we can elongate that interval because we're catching things really, really early with this test. So it's a really good test. We've moved to this now because the technology allows for it. And so this is good news. Okay. The test is done in a similar way. So with a pap test, women would have to get a pelvic exam, a speculum is used, and then a swab is taken of the cervix. And that sample was sent to a lab where someone would look at it under a microscope to see if there's abnormal cells. Now, the same procedure is done. We're still doing a pelvic exam with a swab in the cervix and taking those cells, but this time those cells are not being looked at under a microscope in the same way. Now they're being tested for the DNA of the HPV virus. And this is why we're able to notice things even earlier in the progression and the development of abnormal or a cancer cell. So if we notice that there's some abnormality, so if it's positive for the HPV DNA of a certain subtype that we're concerned about, like 16 or 18, as I mentioned, then we would do a follow-up test. And this would be either a pap test, where we can now look at the cells, or a colposcopy, which is a way of um, getting a really good look at the cervix and taking a biopsy if something looks abnormal. So the colposcopy is typically done by a gynecologist, so it's a specialist. Okay, so I kind of just mentioned this. So if you have high risk HPV, so 16 or 18 in the screening test, because remember, we're testing the DNA, so we're going to know the subtype. Then you go to colposcopy. If it's a different high risk type, you could repeat the test in 12 months because I didn't mention this earlier, or actually I did, but I didn't dwell on this. But basically, HPV is something that is very common, and we clear this from our body very often, which is why the pap test before, or even now, this new HPV DNA test, it starts at age 25. It doesn't start at like 15. Why? Because early on, we're really, really good at clearing this from our systems. And even as we age, HPV sometimes can cause all these problems, but it's very common and often it doesn't. So we want to give your body a chance to see if it'll clear it on its own before we rush into doing interventions, right? So it's a balance. So in the second point, if it's a different high risk type, we will repeat the test in 12 months, see where we're at that time, and then decide if we need to intervene with colposcopy. And then if it's a low risk type, just routine follow-up. Okay, so some myths. I think I addressed this as we went, but old thought is that HPV only affects women. This is wrong. Get this out of your head if this is in your head. Everyone is affected by HPV. Everyone is benefited through vaccination. This will help men as well. And then it'll also help women with men getting vaccinated because then we won't be transmitting HPV as much. So that's why the Ontario government has made this prudent decision to fund it for not just girls, but for boys as well for the vaccine. Some people think, oh, if we vaccinate our kids for HPV, then that's basically telling them that they should go and, have sex. This has been proven to be false. It's understandable where this thought can come from. However, evidence has shown that this does not actually increase sexual activity. So it's an unfounded claim. And then some people think, oh, I'm already sexually active, so it's like too late for me to get the vaccine. And that's false. Remember, there's 9 types of HPV. You don't know what type you might or might not have had. This is this vaccine is safe, so there's very little downside in getting it. This is going to protect you from 9 types of HPV. It could prevent genital warts. It can prevent warts in other places, and it can prevent cancer. So, uh, I would recommend this vaccine. Um, I know some of you here are working as healthcare workers, working in the community. So, what is it that you can do? Well, make sure that your patients or your clients, people who are eligible for this vaccine, know that they are and that they get vaccinated. And just getting the facts out there, or even getting, connecting them with me so I can talk them through this decision is very helpful because we want ideally everyone to just get this in grade 7, get it for free, get it over with, and now they're protected. This is a great public health intervention. Another thing you can do is just staying up to date on the guidelines, attending talks like this, and then just letting people know about HPV prevention. So that's it for now. Thank you. Uh, I'm going to open this up for questions in a second, but I also just want to remind you that I put this link here, shn.ca/vaxfacts. That's how you can book an appointment to speak with me about any vaccine, including HPV or anything else, measles, or, we're called HealthFacts now because you can talk about anything related to health. As long as it's something I can talk to you about over the phone, then we can do it. So, tell your patients and clients about this as well. So, well, yeah, if anyone has questions, I'm happy to take them at this point and try my best to answer them. You are muted, Hannah.
Sorry. Thank you, Dr. Latif Murji, for the amazing presentation. If okay with you, we will be taking some questions from our participants. Here, I have some of them. How does someone know if they have an HPV if they don't show symptoms?
Yeah, so then that's why we do the screening. So first of all, like if you don't have symptoms, that's great, right? Like your life in this moment is not, troubled by this virus. So that's good. However, uh, you could develop symptoms later. So that's why we have screening tests so that we can detect something before symptoms arise, right? Like for someone with like someone who has early cervical cancer, they might not have any symptoms, but they have probably like HPV 16 or 18, and the screening test would show this, and it would show it years before any symptoms arise. But if you wait till symptoms arise, then you're way later in the progression of your disease, and then the treatment is going to be more radical, and we might have to do, very extreme surgeries to make sure that, we keep you safe, right? So you don't want to wait till you have symptoms to do screening tests.
Yeah, thank you for your answer. The first question actually leads us to the second question, which is, what are the symptoms of an HPV infection?
Yeah, so often there are no symptoms, right? So, but otherwise you could have warts. That's basically that's what this virus is. It's not like you get like a, a fever or something. This is it's like a local infection that causes warts. That's the symptom of HPV, or you just don't have symptoms. And as I mentioned, the warts can be genital warts, but they could be in other places as well, like your hands, your feet, or in your oral pharynx, which is like your mouth area.
Yeah, so do we understand that HPV infection is a localized one?
Yes.
Yeah, great. Are there any side effects related to the HPV vaccine?
Yeah, so great question. This vaccine is very safe. So the side effects are actually the typical vaccination side effects. So that includes sore arm, right? So this is an intramuscular vaccine, which means it goes into your deltoid, like your shoulder, basically. into the muscle. So often people have a sore arm from that, or they could maybe get a little bit of a fever or feel tired and some muscle aches for a day or two afterwards. But even that is not very common. Um, yeah, so it's just typical vaccine side effects. You might have a bit of a headache, you might feel a little bit nauseous. But all of this clears up within a couple of days. And if you take a Tylenol or Advil after your vaccine, that would also help minimize those symptoms.
Great. Another question. If someone is already sexually active, is it still worth getting the HPV vaccine? I think you mentioned that during the presentation, but you can give us more details.
Yes, I think that was right here. The third myth. So yes, it is still worth it. Um, according to Health Canada, if you're under 45, then yeah, it's worth having the conversation with your physician. If you're in the age group of like teenage years, then definitely it's like no question about it. If you're above that, like over 26, then I would say it's something to talk about because you might have different risk factors, right? But don't rule this out at all if you're already sexually active, because as I mentioned, you could still benefit from a vaccine that prevents 9 types of HPV.
Great. Are there any long-term health effects if HPV goes untreated or undetected?
Yeah, that would be the risk of cancer. So, yeah, the reason why we're screening is because we want to detect HPV or the high risk types of HPV so that we can prevent cancers. And we can just keep a really close eye on people who have shown signs of, uh, early forms of abnormalities that could lead to cancer. We want to identify those people and really keep a close eye on them. So cancer is the biggest concern from HPV, and then the other one is warts. You don't want either of those, but one is definitely worse than the other.
Yeah, great. What can they use to prevent HPV before treatment?
What can we use to prevent HPV before treatment?
Yeah,
Yeah,
general
that would be
idea.
the vaccine. The vaccine is the way to prevent HPV and also limit, like, if you see warts, you know, that's going to be a high risk of transmission. So don't touch warts, whether that's self-inoculation, like your own warts or someone else's. But also, as I mentioned, you can transmit HPV um, without it being like a wart to skin contact. So yeah, so the best way to prevent it is the vaccine, and then um, limiting the number of sexual partners, using a condom. All of these things will decrease the chance of transmission of HPV.
Yeah, can HPV be treated and how?
Uh, no, it cannot be treated. You can treat the warts, but you cannot treat the HPV. Your
Oh,
immune system will has to clear it on its own.
from the chat as well, a client asked if she can get the vaccine. She is 38-year-old, sexually active, no sign of HPV, because she needs to pay it out of her pocket. What is your recommendation?
Yeah, so in a case like this, my recommendation is that we speak one-on-one because there's a lot more medical history that I would need to get from this patient to understand their context and other risk factors they have, and even their socioeconomic situation would play into this.
Yeah, in this case, VaxFacts or HealthFacts Plus is the best option, right?
Correct. Yes. And you know what? Let's I'll put the link right here so that everyone has it. There we go.
Great.
Amy's got it. So yeah, save that, bookmark that link so that you can pass it along to people who need it.
Great. Thank you. How does HPV affect men differently than women?
Well, the difference is that men don't have a cervix, so they can't get cervical cancer. But they can still get warts on, anywhere on their body, including genital warts. No one wants that. And they also have, oropharynx, and they have, they can get penile warts or penile cancer, and oropharyngeal cancer and anal cancer. So those are some of those things women can't get. So you know, no one wants cancer anywhere, and thus preventing HPV is your best way to prevent cancer.
Yeah, I see. Does HPV affect pregnancy?
Does it affect, pardon?
Pregnancy.
Oh, pregnancy.
Yeah.
Uh, if you, so you can have transmission of HPV through like birth. So remember, it's a local infection, so it's not like going to affect the baby in the womb. But then when you're delivering, you can actually transmit it. It's called vertical transmission. So, yes, there's another reason why we want to prevent HPV, because we don't want our babies to get it.
Great. Is there any booster shot for HPV vaccine?
You do not need a booster at this time, but there are some people who had who may have had the vaccine before it became Gardasil 9. So like now it has nine, prevents nine subtypes, right? And that's been in the past like 10 years or so. There's people who got vaccinated before that, and it's possible for them to get a dose of Gardasil 9, which would, give them some added immunity to some subtypes that they might not have had covered in the past. So again, this type of nuanced discussion depends on the person's age and medical history and situation, and would be best uh, that discussion would best take place one-on-one with the healthcare practitioner.
Yeah, thank you. Can someone get HPV again as a recurrent infection?
Yes, for sure. So your body could clear it. You could get it again. Remember, there's so many different subtypes. So yes, you can get it again.
How many doses are needed to be fully vaccinated for HPV?
So as I mentioned, there's 2 doses needed if you're under 15 years old, and 3 doses if you are over 15 years old or immunocompromised.
Thank you. Any other questions?
And so at this time, we will